Well, among the recent federal layoffs were CDC staffers responsible for tracking the success of fertility treatments like IVF. Now that entire monitoring system, which has been in place for decades, is in jeopardy. Reporter Christine Pei has more on what this means for healthcare providers who are now awaiting guidance from the federal government.
For patients seeking fertility assistance like in vitro fertilization or IVF, doing research about it is part of the process.
Long story short, my husband and I have been trying to have a family for several years.
Bethany Arnold of Issaquah recently finished her 7th egg retrieval cycle. She knows a thing or two about federal cuts, having worked in global reproductive health for USAID.
We had some research projects looking at infertility in different countries in Africa that got canceled.
And her own journey with IVF has not been easy. After a poor experience at one clinic, Bethany switched to another one, and part of that transition included studying clinic outcomes.
CDC, they have calculators too that determine kind of based on your personal circumstances.
She's referring to this CDC webpage detailing procedure outcomes from assisted reproductive technology, or ART. Here you can find out a specific clinic's pregnancy rates from embryo transfers, plus a wealth of other data.
And they play a really important role in tracking the fertility treatment outcomes, promoting patient safety and ensuring transparency across clinics.
Dr. Julie Lamb is a reproductive endocrinologist and medical director at Pacific Northwest Fertility based in the Seattle area. Dr. Lamb points out that by law, IVF clinics must report treatment outcomes to the CDC.
All doctors want to do their best for their patients, but it just holds us accountable to a different level.
But the future of CDC monitoring is now in question after HHS, directed by DOJ, slashed the staff responsible for tracking and publishing IVF success rates and other data.
Because they fired everybody who was working on that data, it is not at all clear if that data is ever going to see the light of day.
Sean Tipton is a policy officer for the nonprofit affiliated with the Society for Assisted Reproductive Technology, or SART, a professional group that gathers IVF outcomes from its 371 member clinics nationwide. Tipton says they will continue posting data on their non-governmental website.
So there is going to be some data still available for the public, and I think that's important to understand. What we really have lost here is the epidemiological expertise of the team at CDC.
Well, the timing of the cuts comes as more couples seek fertility treatments than ever. According to SART data, IVF cycles performed at member clinics increased by nearly 11% from 2022 to 2023.